Welcome to Twin Cities Leaders. I'm your host, Kevin King, and I'm really excited to have our conversation today with Julie Olson Rand, who's the Associate Director of Access Programs at the University of Minnesota. And this episode is about mental health in the workplace, and I'm really excited to unpack this topic. I think it's relevant. It's going to help people, and certainly even myself, just as a 53-year-old African American man who is a Gen X generation. It's going to be beneficial for me, and I'm approaching this really out of curiosity and to educate and inform myself as well. So, Julie, welcome to Twin Cities Leaders.
Thank you so much, Kevin. I'm really pleased to be here.
Okay, so can you break down your title, Associate Director of Access Programs? What does that entail?
Yes. So I work within the Disability Resource Center, or the DRC, at the University of Minnesota. And we have about 65 employees and then 30 some student workers. So we're a very large office. Um, so previously, I worked at a private liberal arts college for women in town, and I was the director of that office, and we only had about a team of 5 people. So coming to the University of Minnesota, it's such a large institution. And so we as leaders are able to kind of specialize in my niche area. I was a sign language interpreter for 15 years. And so I have a lot of skill and expertise and knowledge of sign language interpreting. And then so I oversee the interpreting captioning unit, and that includes 8 interpreters and our coordinators and a manager over that team. And then I also oversee the testing and access assistance unit. Um, and so I'm overseeing our testing center. We have a large number of students that utilize testing for accommodations, and then access assistance includes things like note taking for more like our blind, low vision students. So I think of myself as somebody who oversees like the service provision side of the house, and then we also have student access that does the consultations with students and determines their accommodations. Then we also host U-Return, which is more for like the faculty and staff accommodation needs. Oftentimes, faculty and staff accommodations happen within HR departments at universities, but here at the U of M, we're a little bit different in that that is housed within the DRC. We have a few other units that are specific to like document conversion and technology and physical access, but generally speaking, I'm kind of overseeing the service provision side of the house.
Well, when you mentioned sign language, that resonated with me because one of my students in my organization and management of sport class on campus, they do TED Talks on different organizational leadership topics, and she used sign language as accommodation. She did a TED talk on how to use sign language to help communicate with the deaf community in the workplace. And she started her TED talk off with doing some sign language, like no one knew what she was saying, and then but it was so powerful because it really set the tone for like how important it is in terms of having that accommodation in the workplace. So I want
Definitely.
to ask you, Julie, like when you think about mental health, like what does it mean to you?
Well, I have personal experience with a mental health condition, and it really runs in my family and then on my husband's side of the family. And then, I also am a parent of 3 children, and we've begun to identify mental health conditions within our children. And I just really think of it as an aspect of our health that we must tend to and be cognizant of so that we can be whole, full, well human beings. I think for a lot of my upbringing, because I'm also Gen X, um, I think there was a lot of stigma around mental health, and it really wasn't spoken about in families and out in society. And I think about kind of the depictions of mental health or mental illness within media. It was often pretty negative. The connotations were pretty negative. So, I really feel like a lot of my adult life has been kind of coming to terms with my condition, and that it's going to be with me for my lifetime, and that I should probably get comfortable and learn some good coping mechanisms. And I also really feel like my work within the disability services field, and then also just in my life, I feel like being open and talking about mental health will only help reduce the stigma. And yeah, there might be some people that might criticize or, have their own negative thoughts or feelings about my sharing, but I feel like the good outweighs the bad. And I just really feel like we should really elevate our knowledge and support of people with mental health conditions because, especially since the pandemic, it's most of us. Like, let's be honest,
Yeah.
most of us had some impacts during the pandemic, and we're noticing within higher ed that like more than half of our students are presenting with mental health conditions. So it's just very prevalent. So I really feel like it's a big part of our health.
What made you wanna pursue, this line of work?
Yeah, well, I have kind of an interesting story because I was working as a freelance sign language interpreter. I had several different employers, so I kind of had this mosaic of different employers, and at the time, that really worked. A lot of interpreters worked in this kind of gig economy, and it worked out for us. And what happened was, I have 3 children. My second child was born with 1 deaf ear, so she's unilaterally deaf. And, as interpreters, when we're out in the community, we interact with some people that aren't very well informed about deafness and about deaf culture, and we overhear things that are not positive about the deaf community. Little microaggressions, like I remember being in a hospital and interpreting for a deaf patient, and their hearing spouse was in the room, and the nurse said to me, "Oh, this deaf patient has an entire deaf family. Their parents are deaf, their siblings are deaf," but they said it with a tone of voice like, "Oh, poor family," and from my perspective of someone who's been really educated about the deaf community, deaf people often have pride in their deafness, and they often feel like they're actually kinda happy when their child is born deaf because it's like, "Oh, we have this shared identity," and they can kind of instill upon their children, um, the kind of norms of the deaf community and their shared language, and it's thought of as a positive. So the idea that this person had such a negative viewpoint and that the hearing spouse could hear through the curtain what was happening, it just really hurt my heart. So those types of microaggressions, when I had a child who was deaf, we often within the community call anyone with a hearing loss deaf with a capital D. So even though my child is maybe more hard of hearing than completely profoundly deaf, she would be categorized as someone who is deaf with a capital D, culturally deaf. Anyway, so now I have a deaf child, and those microaggressions feel like a microaggression against my child too. And so I started to feel a little bit differently about my role because as an interpreter, we tend to be neutral and impartial, and we're sharing the messages that are said by others, and we don't often have our own voice in the community. We kind of stay out of the conversations other than our interpretation. And I just realized, like, I'm gonna be an advocate for the rest of my life because my child is gonna be growing up with an IEP and with accommodation needs, and I need to support her. And then I thought, maybe in my career path, I need to be thinking about ways that I'm giving back and advocating and really flexing these muscles in my professional life. So I went on a soul search. It didn't happen immediately, but I ended up applying for this role at my previous institution. That was an assistant director role, and that role required the knowledge and ability to like coordinate interpreter services, and I felt that I was well suited for that. Although I will say, like, learning how to do access consulting and working with students of other disabilities was a stretch for me, but I felt I was up to the task. And because this was my alma mater, I also kind of knew people and knew that I could be supported. And so I did get the job, and I had 2 wonderful mentors that helped support me in learning what I needed to learn. And the team was just so caring and supportive as well. And I really thrived in that environment and then got connected with our local chapter of our national organization, and things kind of grew from there. I was able to move up the ranks, and then, after a few years, ended up, about 5 years, moved over here to the University of Minnesota.
Let me ask you this, my uncle, he's, passed away a while ago, but he was, deaf as well. And when you were talking about that, it really just reminded me like, "Oh, wow," like I had someone in my family who, was deaf, and so, that, again, resonated with me as well. I wanna break down, like, what mental health is. This for people out there who you may need some understanding. Like, what are some of the stigmas and misconceptions that you are seeing out there in the workplace around mental health?
Yeah. So, mental health really incorporates any psychological condition. So, the ones that come to mind are things like anxiety, depression, which are so prevalent, but also conditions like PTSD, schizophrenia, borderline personality disorder, and other personality disorders, obsessive compulsive disorder, and so on. Um, and really, it's like we mentioned earlier, the stigma around mental health conditions has really been high, and in the past, I feel like those who would present to offices like mine or even in the workplace, would tend to bring forward, I'll categorize it as medical, although I believe that, mental health conditions are a medical condition, but I think, kind of the zeitgeist of the time was to think of a medical condition as something like, oh, somebody who was born with spina bifida and uses a wheelchair, they're gonna need physical access in their workplace, and kind of that's what you can see is like, oh, a person who's a wheelchair user, so therefore you'll need an accessible workspace. Or perhaps it might be, something along the lines of, well, I have a migraine condition, so this when the migraine happens, I'll need time off work. Um,
Mhm.
and so, those kinds of accommodations seem more straightforward, whereas with a mental health condition, um, it can be a little bit nebulous what a person might need to gain access in a workplace, and, a person with a mental health condition might not necessarily know, like, "Oh, I qualify for an accommodation," because I think for a long time, the the folks that were needing accommodations kind of had something in mind that would resolve their, kind of accommodation need, and it was pretty straightforward. Whereas when it comes to mental health, um, it's not necessarily a given that a person would know exactly what would solve their kind of accommodation need just from the get-go, especially if somebody had an onset of their condition in adulthood and they're still navigating how to manage that condition. But what I'm seeing now within higher ed is that, students in particular are asking for accommodations like, flexible attendance and flexible deadline extensions. And if we think about how that translates in the workplace, that could be something um, like intermittent FMLA. So when a person is having a flare of their condition, they have a little bit of flexibility when it comes to attendance. Or things like deadline extensions on projects, like, "Oh, I'm having a flare, so I might need a few more days to finish this up because of what's going on with my health." But, of course, that requires being open and asking for the accommodation. Employees don't necessarily need to tell their boss what their mental health condition is, but they probably would have to go to HR and share medical documentation before something formal could come into place. Although a lot of employees, I think, are pretty comfortable talking to their supervisor. It just kind of depends on where the person's at.
I know in my even in my classes, probably in the past, I don't know, 7, 8 years when I get an accommodation letter at the beginning of a semester, and again, I've been teaching for 20 years now, and this wasn't always the case, but, I get those accommodation letters with extended, test taking
Mhm.
time, note taking, etcetera, and it's just really has been informative to me. It's made me a better professor because, just of knowing, how to accommodate someone who might need, those types of services. So, and I want to look at this from like a organizational
Mhm.
perspective. I found some research on says in October 2025, so just last month, the National Alliance on Mental Health did a poll that said that while most employees believe mental health at work is important, many still fear the stigma when disclosing struggles to employees and colleagues. And so, how do we, you know, overcome that stigma and barrier? Because we know that it's important, but based off this polling, that people still feel uneasy about bringing that to someone's attention.
Yeah, it's obviously illegal to, like, retaliate against somebody for seeking out an accommodation, but um, you know, I think we know from, like, anecdotally that sometimes people do get pushback or they might have some attitudes from colleagues or peers or a supervisor because of the requests they're making. I think people fear that they might inconvenience those around them and that the work could shift to another person and then it burdens them. And so I think there is still like a significant fear and a significant stigma. I do think we've broken down some of the stigma over the years, but it's still definitely present. Another
Where does that come from though? Like why do people feel that way? Like is there something in the work environment that's making them feel that way? Is it society that's making them feel that way? Like what's driving that feeling?
It's a good question. I honestly feel like it's generational. I mean, I know we kinda talked about that in our previous conversation, but I do think that generationally, there's different kind of orientations towards how important mental health is or whether we talk about mental health, and so, I would say that the younger generations are definitely more open to discussing mental health and requesting whatever they might need in terms of mental health, but, those who kinda grew up in this time frame of like, "Oh, we don't talk about that," or that it might bring shame to the family, so you better not let other people know. Um,
Mhm.
and I count myself in that because my family didn't really talk about mental health until I was, like, maybe a teenager or even older. Um, and I do think many people went without treatment, even in my own family. So, it's like, having untreated, unmedicated mental health conditions, it can cause some real issues and rifts within families and within, probably workplaces as well, so I think people get scared. Another thing that I'd love to bring up is this, issue of burnout. Especially, like, in our current era, I'm thinking about the pandemic, but also in this post-pandemic environment that, I think a lot of our organizations are really concerned about our kind of economic place and will jobs continue to be available, and so that could be contributing to this concern and stigma because what if I bring this up and then it causes differences in my workplace, and then my colleagues aren't as great to work with anymore, and then what does that mean for my career? I know that the job search market right now is not great, so then the idea that your current position might not be as stable, that can be really scary and even be preventing people from seeking the help that they need just more as like a survival mechanism. When I think about burnout, it's actually not a mental health diagnosis per se, it's a syndrome, and, it's characterized by 3 particular, uh 3 particular symptoms, which are feelings of depletion or exhaustion, increased mental distance from one's work, or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. Now, burnout is a syndrome specific to the workplace, which is why I bring it up. And just so you know, that definition comes from the World Health Organization. And I do think it kind of compounds mental health conditions. So if someone has an existing mental health condition and then is maybe overburdened at work or is trying to work at a really fast pace because of the maybe financial situation we're in, maybe somebody left their job and that person wasn't able to get backfilled. And so now you're in a position where you're doing two people's jobs or having to share additional duties that you didn't used to have to do. Burnout is a very real possibility. And in fact, I have lived experience of burnout when my staff turned over during the pandemic at my previous institution. It's heavy and it's difficult to work through. Like, it takes time, and oftentimes time is very inconvenient. So I think that could be also another contributor in workplaces because people are overburdened and are being expected to do more with less, and that's not sustainable in the long term.
When you think about, like, we're looking at this from the angle of, the individual and the employee, but I wanna talk about, like, the employer side of it. So, the American, Psychological Association took in 2023, Work in America study found that 92% of workers in unhealthy workplaces said that work-related stress negatively impacted their mental health compared to 41% in healthy workplaces. So, how I read this or interpret this is that you could be, fine and really individually okay in terms of your mental health, but the environment that you are in can create you to have these different types of feelings around mental health. What
Mhm.
do you say to that?
Yeah, it really, I think, again, ties to burnout and this idea that, like, I just read this book called The Caring University, and in it, the author is interviewing somebody who's like a engineering professor, and this engineering professor says, "Well, you can't run an engine at 100% capacity, and in the same way, you can't expect an employee to run at 100% long term. It's not sustainable." I'm not quoting it exactly because I'm going from memory, but that's basically the gist of it. And I think it's true when you're in an environment that's unhealthy, whether that's a toxic work environment or whether that's like a workplace that's short staffed and people are having to work additionally hard to get the same work done within a given time frame, or whether there's just additional pressures, like maybe it's an economic pressure and people are trying to show their productivity or whatever it may be, that those you can't expect somebody to maintain good mental health in an environment that basically breeds poor mental health. Like, it won't you won't stay healthy long in an environment that's very unhealthy. So, I think a lot about what leaders can do because my colleague and I from my previous institution, we we kind of had almost like a laboratory in that, during COVID, we were called back to the office kind of early within COVID, maybe I remember it was around 4th of July. We were home for, like, a full academic year, and then I wanna say it was, like, maybe, summer of 2021 that we were called back into the office, so it felt kind of early compared to other institutions. So we were masking and we were, doing our best to stay safe and social distanced, but many of my peers and colleagues and my employees were really struggling with, like, how COVID had changed our work and the influx because we had an influx of students that needed service needs and accommodations, and it was like, "How are we gonna manage all this work just amongst this small team?" And so, with my colleague, she was actually my employee, we started developing a workshop that we ended up giving at NASPA and then again at AHEAD, our national organization, to talk about what small bite-sized things departments could do that can support employees' mental health, even though we might not have a lot of additional money to like do some big initiative. And so my employee was coming at it from kind of more of an individual lens or from the employee's lens, and I was coming at it from more of like an organizational lens and as a leader. And so I thought that was nice that we could kind of bring together those kind of two aspects in a single presentation. And so the kinds of things that I think about are kind of more things like how you support an employee in the workplace and how you really get to know your employees. So, a couple of the kind of interventions, if you want to call it that, would be things like, first of all, making sure that you're doing individual one on ones as a leader with your employees so that you kind of know what's going on with their work and what's going on with them personally. Are they okay? Are they keeping up with the work? What kind of issues are coming up and then being able to address those. And then when having team meetings, actually doing like a check-in before you get to business to see kind of where people are at. Are they able to handle the work? Are there issues that have come up? But then also like sometimes I like to talk about just what's going on in your life. So by doing this process, I learned that one of my employees was moving, and then I was able to check in with them later. Oh, how did the move go? Are you sleeping in the new place? And that kind of thing.
So you again, and so you this is a perfect segue to my next question because I feel like you lean more into that it's more of the organization's responsibility to create the environment. So, but what do you say? And I don't disagree with that. But what do you say to those who say that it's up to the employee to manage their own personal, their whatever's going on in their personal lives?
Yeah.
Like, is it? I feel like you're saying that it's the organization's role, but what do you say to people that say, "Well, it's the employee's responsibility?"
Yeah, I think this is a lens that has been used for a long time, and I think it takes that kind of onus off of the institution or the organization from having to really take ownership. It feels like a cop out. So, yes, individuals do need to take care of themselves, just like, I don't expect my employer to take care of my personal hygiene, or to like know about my medical appointments and whatnot. And at the end of the day, if 90% of an organization's employees are not okay because of the environment, that's not the individual's fault. And so the research that I've been doing, because I'm also a doctoral student, and what I'm studying is it's higher ed administration, but I'm also looking at higher ed as a workplace and kind of what changed in the pandemic and in the Great Resignation. So the kinds of things I'm thinking about are like what ways do organizations take responsibility for the types of environments and whether what I come to actually is this concept of a community of care. And this is not like new or innovative that I'm thinking of this. This is something that's out there and some communities do it really well. Some communities have been doing this historically, like I'm thinking of the indigenous community. There's many BIPOC communities that just this is kind of a way of living. And when I think about collectivist cultures, I'm thinking about ways that the community kind of keeps tabs on each other and checks in with each other even before making big decisions. And so I do think we can draw upon some of those kind of collectivist norms or some of those um, community norms to really care within our workplaces. And I think leaders are in a wonderful position to be able to kind of instill those values because leaders can show by doing. They can model those behaviors. So I just remember with my previous workplace, and I still do this, but I have kind of a good example of when I was going through that kind of burnout episode. I had just trained in a couple new employees, and it was like, finally, we can share the load. And I did have a flare of my mental health condition, but I was open about it, and I asked my team for what I needed, and I would take breaks to go for a walk or maybe even to drive home and work remotely for the rest of the day. And the way that my team showed up for me really showed me that, well, this is a really good fit for this environment. And now I hope they know that they can come to me and let me know when they need support. But I think oftentimes leaders need to model the way in order for their team members to feel they actually have permission to, for example, take a mental health day, and to be like transparent about what their needs are. But that requires community. And I do think leaders can build that community.
Absolutely. I totally agree 100%. I wanna talk about, now we're in 4, generations that's working in the workplace, and I
Mhm.
remember when I was coming up, in the late '90s, early 2000s, when I was the young person,
Mhm.
when Gen X was now, the Gen Zs now, and again, really wasn't talked about, didn't know what it meant. I didn't know that it was a word or anything. But now, I'm obviously grown up, and now you have the X perspective, but then you have Gen Z, you have millennials, you have baby boomers, and
Mhm.
so just can you just talk about, like, just the differences just in terms of lenses that people look at, mental health.
Yeah. Well, first, I'll just say that I'm not like an expert on generational differences, but I just feel like anecdotally I could share a little bit of my perspective. Um, I think it's helpful to understand the context of the kind of time, the kind of zeitgeist of the time in which people from different generations grew up, because that really will influence kind of how they go about their lives and their work. When I think about boomers, I mean, both my parents are boomers, kind of on the older end of boomers. And I feel like in their generation, mental health wasn't historically talked about, that it could be shameful to talk about things. I mean, I think about alcoholism. Alcoholism is pretty rampant in my family, but it's not something I feel like people would tell their neighbor or tell people at church or those kinds of things. It would be more
Mhm,
like people want to save face and keep up appearances. And so those things are really not something that are shared, at least in that time frame. So that's what comes to mind when I'm thinking of boomers. It's kind of taking a mental leap to learn about mental health and to educate oneself to get to the point where it's like, oh, okay, um, I can get with the times, but
mhm.
it's definitely a hurdle, I think.
You know, you said my mom, my mom is 80 years old. My dad, he was an alcoholic. He passed away 26 years ago, but you're right, like, did not want anyone to know about it, wasn't something that, publicly they wanted to discuss or admit to, and so I think now, like, it would be totally different if someone was going through a substance abuse, anything substance abuse related nowadays, I feel like how people would look at it and support it and try to help someone is totally different than like a baby boomer.
Totally. And then so next would be Gen X, and I consider myself Gen X, although I'm kind of on the cusp with millennial, but I have older siblings who are also Gen X, and so I feel like I kind of have a little window into their aspect of the generation as well.
We're
Um,
gonna adopt you as Gen X.
yeah,
You come on over with us with me.
I like it, like Atari and the old school stuff. I love it.
You want a hybrid. You're like, hey, I'm a little
I
millennial in there
Yep,
too.
I'm a little hybrid. A Zennial, I think is what we call it. Okay, so we grew up in an era where our parents and trusted adults often didn't talk about mental health, maybe not even until we were, like, in our teenage years or adulthood. Many went untreated with mental health conditions. We're kind of expected to tough it out. Depictions we might have seen about mental health in the media were things like One Flew Over the Cuckoo's Nest, which is a very scary story, right?
Yeah.
Um, and I just remember in that movie and the book, the patients are treated so awfully. So I know that that story took place, I think in the 60s, but it's like that was a movie that people were watching at the time. And so um, that's the depiction. That's all we really had. We didn't have much else. Um, and then in terms of millennials, um, millennials grew up in a time when the stigma, it's still real around mental health, but it began to change maybe in people's kind of middle school era and into high school, just like services became available. I'm thinking about even in my own life going to the doctor, and that even just with a physical checkup, you begin to see screenings for depression and anxiety, which was just not a thing prior to this era. So people who are millennials are growing up in an era where that's normal. And so maybe that's all they really know is, oh, well, they always check my mental health when I go to the doctor because mental health is health. But previous generations, that wasn't really part of doing a checkup. We didn't really talk about mental health.
You are so right. I remember, like, even when I go to the doctor now, they ask me, questions like, "Do you feel safe at home?" Or like, "Do you have enough food to eat?" And I remember, like, this happened at my last doctor's visit. And I said, "Well, why do you ask me that? Like, I mean, why?" And she was like, "Because really, it's a mental health check-in to make sure that if someone's okay, or maybe they're in the doctor's office, and maybe they don't have family." That's in the room, and they may feel safer, enough to share what's going on at home
Mhm.
so that the doctor can, help that individual who may not have a space to share those experiences.
Right. I feel like doctors' offices are a hub for resources like social work or other community resources. And if folks don't know what's out there or might need a referral in order to go to a mental health provider, I know often when we're at our worst, like in a deep depression or in a really high anxiety flare, which I just mentioned because those are two really common conditions, it's probably the hardest to ask for help. So if you have somebody that's going to intentionally check in with you, even if it's just once a year at those annual appointments, they could probably capture like a wide, with that net, they could capture a large number of people that might be silently struggling. So I do think it's a good practice.
Let's transition into men and mental health. And we know society has shaped the way that men either do or don't talk about mental health. How do you see that changing, and do you feel like society is changing with that?
Yeah, I do want to talk about that, but do you mind if I just say a little bit about Gen Z first?
Yes, go ahead.
Yeah,
Yes.
okay. So I feel like Gen Zers might not remember a time when there was silence around mental health. And then I'm also thinking about Gen Z because a lot of Gen Zers are college age, or entering college, or have just finished college. And I think about how on admissions visits, oftentimes they will actually highlight the mental health services and other supports that are offered for students. And even like offices like mine, students will come and kind of do a trial run and see, well, do you offer services? Who would be the one supporting me? And those become maybe not the deciding factor, but contributing factors for deciding where the student goes to college. And that I really don't think was like, it definitely wasn't the case when I was looking at colleges. So I feel like students or young people, Gen Zers, are thinking about their mental health, are being proactive about where they're going to get support. And that's like built into kind of the way in which individuals are living their life. And there's really not a lot of stigma. I mean, there's still stigma, but maybe generationally not as much. So seeking services is just like going to the dentist. Like, well, I have my therapist, of course. So I just think it's great, and I'm hoping that that progress will continue with our next generations.
It'll be because the next generation coming up now is what is it? The
Gen A, Alpha. Yep, my
alpha,
kids
yeah.
are Gen Alpha.
Yes, it'll be really interesting to see that how it, because I mean, it's evolving, it has been evolving, and I mean, because even, like, millennials, I think about, like, they were the first to grow up, like, with smartphones
Mhm.
and that whole thing, so it's always something, you know
Yep.
what I mean? Like, I think, like, with Gen X is that, we're like a hybrid because 'cause we've kinda lived on both sides of it,
Yeah, yeah.
and so we've been able to grow with it. So yeah, no, I totally agree. I think I love that topic of talking about the 4 generations because it's real, and
Mhm.
and a lot of people don't discuss it, and there are people, like, who are in their 20s and 30s who have bosses and supervisors and leaders who are older, and it goes back to what I was saying earlier about the people realize that it's important, but they don't feel comfortable enough to share it, and in part, that could be just because of they might not think their leader would even understand, based upon, the generation that they grew up.
Yeah. So true. Well, let's talk about men. I do think I do think historically men haven't sought treatment for their mental health conditions. Certainly at much lower levels than women historically. And I mean, there's this concept of stoicism, and like, trying to be strong or thinking of themselves as the provider. And so, well, I wouldn't take a time out to go to a mental health visit during the workday. Like, we're just going to keep going. Um, and I will say, like, I have some experience with this in that my husband had, an episode during the pandemic where he began compulsively gambling, and, I actually caught him, so He didn't come to me to, like, admit it, but, once I caught him, we had to really address it, like, "What's going on?" And,
How did you catch him? What do you mean when you say you caught him?
well, I was looking through our bank statement, and I was seeing a lot of outflow of money to an unknown entity. I thought we had been hacked, and so I was at work actually, and I called him up and I was like, "We've been hacked. We have to figure this out. We'll have to go to our bank and try to get the money back." And he was like, "No, that's right." And I was just like, "How the heck are all these?" It was like a lot of different, um, like, transactions that had happened, and it added up to, like, some money, you know what I mean? And I
Yeah.
was just like, "How is this right?" And so, I just remember I kinda raised my voice, and my coworkers were in the office next door and around the corner, and later they were like, "What is up?" I'm like, "Okay, yeah, this is probably not a
You're
good
like, "I'm broke."
situation to be in at work," but I just was like, "We gotta talk." So, at the time we had started some couples counseling. We had just been working through some stuff anyway, and honestly, I kinda wonder if I'm pretty intuitive. I wonder if I kinda knew something was hidden, but I just hadn't pinned it down yet, and so when this came out, my husband was so distraught and felt so guilty, um and it led to him getting his own mental health provider, and, he has some stuff probably to work on from childhood, don't we all? And, now is able and has continued that, so this has been quite a few years, but he has his own individual therapist now, which that was all brand new, and we're in our 40s, so, I really congratulate him for moving forward and doing that. But I just think he probably could have benefited from a therapist all along. It's just he didn't think of himself as someone who needed one. And so I really feel relieved knowing that he's getting the support. He has someone to talk to that's not just me or just a friend, someone who is trained and can really help him reframe some of the thoughts he's having um or, he's also drawn upon, like, Gambling Anonymous, so that's obviously another resource out there for people struggling with this type of compulsion. But, yeah, had that not happened, I just wonder if he ever would've gone forward and gotten
Yeah.
a therapist.
Well, I think in our society, I mean, we are American society. I mean, you hear a lot of, no days off. You grind and sleep when you die. Or I mean, people post TikTok videos, workout videos, like it's all about the grind. And so I think, like, for men, it's like keeping up with that expectation of what they see online and with just the societal pressures that maybe even their parents might have bestowed upon them growing up, like that you mentioned earlier, that they are the provider and they do not need to show weakness and it's not masculine and all those things that we've constantly heard over the years. That's still in society, you know what I mean?
Mhm.
And that's what, when we talk about these 4 generations, it's like you're just it's like a melting pot of all these ideologies and philosophies on it.
Yeah, I think about that. I'm a doctoral student, and I think about that in academia. There's such a grind culture. And once people finish a PhD, if they go into the academic workplace, it's like, but I got to get published, I got to get tenure. And so there's such a grind there. So that's kind of where I feel like I feel it. But I think you're right that for men, it might be a different experience and so heightened when it comes to the grind. And it's a survival instinct because people are having to support their families. I know, historically, it was often men who supported their entire family. These days, I feel like a single person can't just support a family. It's very difficult. So it's like both parents often are needing to to work in order to provide for their families, and I don't mean to speak only on, straight families. I think it happens in the queer community as well. Like, there's a lot of hustle just to get by, and especially as inflation is going on and, everything that we're used to buying is more expensive, it's just difficult. And, you made me think of the book, Rest is Resistance, and just how to reframe kind of our need for rest because we are humans and we can't expect ourselves to go, go, go. And the idea that we even have to think of rest as a resistance is sad, and it's powerful at the same time.
Mhm. Yeah, and I feel like, again, it's how people look at men, whether it's women or however you mentioned, like, it's not just to just, straight men and women, but just masculinity in general,
Mhm.
you know, and the, expectations that are put on men to perform in all these different spaces, whether it's at work or at home or being a parent or, a son or whatever that, it's it that they had to suppress it. You know
Yeah.
what I mean? I feel like now it's starting to be a lot more recognized or appreciated or welcomed without the negative, like, stereotype. You know what I mean? Like, "Oh, you're going to counseling, like, oh, you must be this," or "You're soft," or, like, those type of stereotypes that are associated with men and mental health.
It's so true. Because I hope people understand that when you go to therapy, it helps you to be able to analyze kind of where you're coming from and maybe appreciate your relationships more. A person who's gone through therapy is probably a better partner and spouse, and it might help you to approach your relationship with children and that has a huge impact. I mean, we don't want to traumatize our children, if especially if we were traumatized as children, we know what it's like. So, I feel like oftentimes when my husband and I are talking about our experiences with therapy, we're talking about how we wanna break the cycle, and we wanna make sure that our children don't have the same traumas we had growing up, and we wanna make, this environment healthier and a better one so that we're not just perpetuating what we grew up with. So I do think there's a little bit of there's a lot of work in that. It's difficult, but I think it's worth it and important.
You know, Alex Rodriguez, the, now owner of the Minneapolis, Minnesota Timberwolves, um, amazing baseball player. He's out with, his new documentary called Alex versus A-Rod, that's on, HBO, and in an interview, I saw him talk he specifically talked about that he's been in therapy and how that has helped him become a better person, over through as he's evolved outside of baseball. That's an example of where I feel like 10 years ago, that would not have been admitted, or that might not have been at least publicly admitted. And for someone like him with his notoriety to be able to say, like, hey, like, therapy has impacted my life, it's made me a better person. I think it speaks volumes, and is where it's trending, or it's heading in that direction more.
Yeah, and you think about someone in his position where, I haven't watched the documentary yet, but that sounds awesome. Um, if somebody has a lot of financial resources and maybe time resources, and that's what they're focusing on, I mean, I think that's really telling. Oftentimes, I feel like with the grind, we don't have a lot of time and energy to pour into anything other than work and then our families. So it can feel like, well, mental health isn't as big of a priority. And anyway, if there's stigma, it's like that's just not what I'm going to focus on. But if you are looking at people in society who are resourced and are touting what a big difference this has made for me, it's kind of in the similar way that I was talking about how leaders can kind of demonstrate and kind of show the way. Hopefully, those that have that public voice and that platform are able to kind of make some ripple effects out in the community because it is important.
So let's get to my, rapid fire questions for you here. So I'm gonna ask you a question, you just kinda give me your thoughts on it.
Okay.
So, mental health struggles are a sign of weakness, true or false?
Absolutely not.
Okay.
False.
Alright. False, okay. If someone looks, uh, if someone looks fine, they must be fine.
False.
True or false?
Definitely
Okay.
false.
Suicide is selfish.
False.
Men don't talk about mental health because they do not care.
False.
Okay. Mental health days are just personal days.
False.
Depression and anxiety are the only real mental health conditions.
And false.
Substance abuse isn't a mental health issue, it's a choice.
False.
Okay. All right. And if someone dies of suicide, they committed it.
False.
Okay.
This segment is sponsored by Kowalski's Markets, where it's all about the joy of good food.
Now, Julie, we're going to transition to our hidden gem segment. This is the segment where I ask all of my guests what is your Twin Cities hidden gem, and it can be a place, event, or experience.
Sure. Well, my family moved to Egan not so long ago, so I'm going to choose an Egan gem. This place is called Vandella. It's a coffee shop that has like a European flair. They've got some good food and great coffee. And then one of the things I really love about it is that it's also a little gift shop, and they feature handmade items by local artists, including things like jewelry. They have this adorable like watercolor painting book that kind of teaches you um, how to paint, and they have paints there that you can purchase. They've got let's see, candles and lamps and just lots of unique gift items. So that's the one I've decided to choose today.
All right. Well, Julie Olson Rand, I really appreciate your time today, and this information is just so invaluable. I learned a lot. Like again, I just love listening to you and talking about this conversation and bringing more attention to the subject. So thank you for joining me on Twin Cities Leaders today.
Of course. Thank you so much for having me.
And you can find me on Twin Cities Leaders on you can listen on Spotify, watch on YouTube, and also follow on Instagram and TikTok. So I will see you or next not next week because this is our last episode of season 2. But one quick question I do want to ask you before you leave, and that's because when this episode drops, it'll be December 4th. We would have just passed Thanksgiving, heading into Christmas. How much does the holidays impact mental health in bringing the stresses of like what's going on at home into the workplace and vice versa, bringing the stresses at work back home in this holiday environment?
That's such a good question. I think of this in kind of a lot of different ways. One is that it can be a really lonely time for people, especially if someone's lost a loved one, or maybe one of their. I'm thinking of a spouse or parents, or even a child. It can be a really difficult time that first holiday season without that person, and then the subsequent years can also kind of mark time without that person. So it can be really difficult. I've heard that suicides increase during the holidays, and so that's a concern. It's certainly, I think, due to loneliness. And then another thought I'm having is that there can be like financial strain because I know Christmas is a gift giving holiday. And so if you're thinking about like, oh, how am I going to make ends meet, especially in a time where we're in an inflation kind of economy, that can be difficult. And so that's another thing that I think about that could kind of impact people's stress, and then stress impacts mental health. So I think it can be kind of a cycle. But then I also think people look forward to the holidays, especially if they are going to be visiting family. And so it can be joyous time. So I think it's mixed. I think it's a mixed bag. Sometimes it can be really positive, and sometimes one might need to be a little bit more gentle with their employees at this time.
All right. All right, Julie. Well, thanks again for your time. I appreciate it. And I'll see you next time on Twin Cities Leaders. Bye now.